I'm Michael Linkoff, the director of the Cleveland Clinic Coordinating Center for Clinical Research at the Cleveland Clinic. And I'm going to review the STRENGTH trial, which was presented at the late-breaking clinical trial session at the American Heart Association meeting this year. The STRENGTH trial assessed a carboxylic acid formulation of omega-3 fatty acids. There's intense interest in whether omega-3 fatty acids modify the risk of cardiovascular disease, and they're used very commonly. But there is still no clear signal of whether or not these are actually effective in reducing cardiovascular disease. This particular formulation is highly bioavailable and is absorbed without requirement of pancreatic lipase. So the absorption is very high and it produces reliable blood levels. It's known as Epanova. And this trial compared this carboxylic acid formulation to a corn oil placebo. Importantly, we specifically used a corn oil placebo because it's a neutral placebo, unlike mineral oil, which does have some adverse effects on cardiovascular markers and may actually be a negative control. And the trial was focused on patients who had high triglycerides, low HDL, and either established cardiovascular disease or risk factors for to be at high risk to development of cardiovascular disease. The primary endpoint was the ischemic endpoint of cardiovascular death, myocardial infarction, stroke, coronary revascularization, or hospitalization for unstable angina. And the trial enrolled over 13,000 patients between October of 2014 and June of 2017. The trial was terminated near the end due to futility, but with a 99.8% follow-up. It was a representative population of patients for these cardiovascular trials. 55% had established cardiovascular disease. All were on statins and 50% were on high-intensity statins. The triglyceride levels were reduced by about 20% by the carboxylic acid formulation. CRP, inflammation markers, were reduced by about 20%. And EPA, the primary omega-3 fatty acid constituent, was increased by nearly 300% in red cells and 270% in the plasma with this formulation. Despite the substantial elevations in the omega-3 fatty acid content, as well as the favorable effects on biomarkers, there actually was no effect on the primary endpoint, the ischemic endpoint, with event rates that were essentially identical between the two control groups. None of the two groups, none of the components of the primary endpoint were effectively diminished as well. There was essentially no difference between outcomes in patients who had established cardiovascular disease versus those who were in the primary prevention, the high-risk primary prevention group. And there was no relationship between the achieved EPA levels in the blood or in the red blood cells or DHA levels and outcomes, so no correlation at all. There were some adverse effects, in particular, the risk of atrial fibrillation, a potentially dangerous arrhythmia, was increased by as much as 70%, and gastrointestinal disorders or complications, side effects were more common with the Epanova. So in this trial, using a true neutral control that does not worsen outcomes in the control group, the administration of this carboxylic acid formulation of omega-3 fatty acid did not reduce major adverse cardiac events, despite increasing the EPA levels and despite having its favorable effects on some biomarkers. And so these findings, in association with the increased risk of atrial fibrillation seen in this and other omega-3 fatty acid trials, does cast some uncertainty of whether or not there is a net benefit or harm with any of the omega-3 fatty acid preparations.